Dr. Cash, with your work that you are involved in oncology and with HPV, can you address the stigma of the HPV diagnosis and how we as a community can help to counter its taboo nature and to bring really a higher level of understanding for the newly diagnosed?
Yeah, absolutely. That's a great question. And I think that's something that we can talk about both from an individual's perspective as well as from the community level. One thing I want to follow up on what Lillian said, she's a shining example of how to be an advocate for yourself. So, if you feel something's wrong and you're not getting the answers you feel are sufficient for you, keep seeking those answers, advocate for yourself, find the avenues that you need to get the help that you need to feel reassured and make sure that you feel like you're getting the care that you deserve. And the other thing that Lillian talked about, she brought up a range of different emotional responses to the HPV diagnosis itself, to facing a diagnosis of anal cancer, the treatment of that cancer, and all of these different sort of complex issues that come along with these diagnoses. And the emotions that one person might experience can be very mixed, and there can be a sense of helplessness in there. There can be some anger. There can be some feelings of, surprise or maybe embarrassment. It can sort of come out of left field for someone. There's, of course, sadness and then some optimism and some sort of this motivation to power through it and kind of get back to what feels like a normal daily routine. All of those responses are valid. There is no wrong way to feel about something like this. And so I think that for a lot of folks, it's hard to remember that, just because you feel a certain way about it and someone else feels a different way about it, doesn't mean that either of you are wrong. There is a vast array of the ways that we can respond to a medical diagnosis like this, and they're all appropriate. And finding ways to manage those emotions and make sure that you're getting the care and support that you need are really important. And I think probably one of the biggest things that maybe folks think when they learn about an HPV diagnosis is that they did something wrong. And we want to make sure that individuals know that this doesn't mean that you've done anything wrong, or that you behaved in a way that you shouldn't have behaved, or that you engaged in a risky behavior that had some negative consequence. There should be no shame in getting an HPV infection. It's so common. And not all of them lead to major issues for folks. And so as has been mentioned earlier, sometimes these exposures happen and they are dormant or silent for years and we don't know that we have them. And so it's incredibly common for lots of folks to have these issues and not even realize it. And so it's not a reflection of any one person's character or their values. And so folks shouldn't feel shame in being able to say that they have these infections if they feel that they want to share them. And they shouldn't feel like they need to apologize for having an HPV infection. It's just something that happens. And I think at the community level, what's really important is educating each other. This is where we have the real power to influence the understanding of what HPV is, where it comes from, what causes it, what it results in, what the strains are, what the potential consequences are, so that we can adequately address together in individual family units with our spouses, partners, children, even extended family, and as well as with our healthcare providers, to really make sure that we're addressing the problem from a proactive stance, making sure that necessary precautions are taken if they're needed to be taken, or getting an understanding of this is just something that isn't associated with high risk HPV, for example. Maybe it's a low risk strain and may never cause issues for someone, and so the need to worry about potential risk in the future is decreased for that person, and so they can get some assurance in knowing exactly what type of issue they're dealing with and what the best precautions are for them to take now and in the future.
Great, that's really helpful, Dr. Cash. And I think Lillian, you may have something to add there too.
Yeah, thank you, Dr. Cash. That was wonderful. What I was going to say is, because I didn't address it when I was speaking about the shame factor. Of course, when they told me I had anal cancer, I thought to myself, are you kidding? What am I going to be? Whoever thought I'd be the face of anal cancer, right? But the actual shock of I have cancer was greater to me than being embarrassed about the type of cancer, because I've always been healthy. I never even got the flu, hardly ever get sick, and I maintain a healthy lifestyle. The shock of you have cancer was much greater. But regarding the shame factor, I really I embraced it, and I said, you know what? It's cancer. Why can't we get cancer there? We can get cancer everywhere, and in our ear, anywhere. So I embraced it. And then one of the things that, Marsha and I have discussed is, wait a minute, we have cancer, and now we're going to be shamed because of the type of cancer we have. So honestly, I really didn't care what anybody thought, and it was my opportunity to say, wow, this happened to me. This could happen to anybody. And I have many people, all ages, who come to me and say, I can't say the word anal cancer. I say, something else. And I said, well, you really should say what it is, because we have to bring attention to this.
Absolutely. Yeah. Thank you, Lillian. Dr. Blank, anything to add?
No, Lillian, your story is amazing. And Dr. Cash, really applaud the work that you're doing. Again, I couldn't agree more that about trying to destigmatize HPV. Again, it's very common. And that's not to minimize it. I don't mean to mean that people aren't going to be upset when they get it, but I think judgment should be gone. I mean, it's a health situation. It's like getting strep throat. I mean, I don't know. It's just a infection, and you deal with it. So, and again, I'm not minimizing it, but luckily, I mean, it's lucky that we know how to deal with this. So I think you can take the information and empower yourself and get an HPV vaccine. That's another thing.